Welcome to the PowerPoint slide for abuse, neglect, exploitation, and abandonment. Following this slide, you will find the abuse, neglect, exploitation, and abandonment exam. Please proceed to that and complete it to the best of your abilities once the PowerPoint is completed. Thanks. What are some signs of abuse? You can't report abuse if you don't know the signs. So let's go over them together so you can be informed and make the call. Physical abuse. An act of another party involving contact intended to cause feelings of physical pain or injury or other physical suffering or bodily harm. Anything you can do to hurt someone would fall into this category. Signs of physical abuse: flinching when someone comes near, crying for no reason or refusing to give a reason, not wanting to be near a specific person, especially someone they were once close to, bruises in multiple colors, and multiple scratches, especially on someone who isn't mobile, and specifically in someone's arms, sides, and legs, as these can be signs that the person was putting up a struggle. Mental or emotional abuse. This is a form of abuse that's characterized by a person subjecting or exposing another person to behavior that may cause psychological trauma. What are some signs of emotional or mental abuse? Crying for no reason or refusing to give a reason, a sudden change in self-esteem, and reacting in a scared or nervous manner to certain persons. Sexual abuse. Sexual abuse, also referred to as molestation, is usually undesired sexual behavior by one person upon another. It is often perpetrated using force by taking advantage of another. When the force is immediate or of short duration or infrequent, it's called sexual assault. What are some signs of sexual abuse? Repeated vaginal or penile swelling, irregular bleeding, and if a person doesn't want to be touched. Medical neglect. Medical neglect is defined as a failure to provide adequate medical care, especially when it is needed to treat a serious physical injury or illness. Signs of medical neglect: late or no refills on medications, and repeated missed MD appointments without a valid reason. Financial abuse. Using someone for financial gain. This includes not only money, but gifts at any value. Signs of financial abuse: utilities such as electric and phone being shut off suddenly, a client requests to borrow money from you, or a client states that his or her bank account is wrong and they don't know why. Can I be accused of this? Of course. Anyone who is involved with a client can be accused of abuse, unless they take the proper steps to protect themselves. How do I protect myself? Well, you report any signs of abuse. Notify your supervisor immediately if you suspect abuse. Always act like someone's watching. Some clients have nanny cams, cameras that are hidden so that they can monitor their loved one's care. Always assume that someone is watching at all times. Take time for you. This is big. Step away if you're frustrated, and don't bring your personal problems into work. It's very easy for someone to say, well, Mom's PCA came in a bad mood all last week. She probably took it out on Mama, and that's how she got those bruises, even if it's not your fault. Exploitation. Exploitation is the act or fact of treating someone unfairly in order to benefit from their work. Can I be accused of this too? Well, when it comes to exploitation, it's really easy to overstep the boundaries between caregiver and attendant and nurse. As a general rule and per company policy, do not borrow money from your client, accept money from your client, have your client co-sign for homes, cars, phones, utilities, etc., and don't accept gifts from your client. Gifts too? Gifts may seem like a simple thing, especially around the holidays, but it's important to understand that gifts add up over the years, and you could be accepting what amounts to hundreds of dollars over the years. If a client's having financial difficulty, you're contributing to this by setting a standard that you will accept gifts. Even if a client is living comfortably and they can afford these things, it's still exploitation. And again, it is company policy not to accept these gifts. What about neglect? Well, neglect is a tricky subject. Neglect can be anything: not bathing your client, ignoring your client's reports that something's wrong, not reporting to your supervisor that something is wrong, ignoring your client's needs, or cutting corners and not fulfilling those needs completely. How do I protect myself? Well, you listen to your client. Watch closely for any signs and symptoms of problems. Report any problems or condition changes to your supervisor or your on care call. And again, take time for yourself. Stress can wear on you. What works for one doesn't work for all. It's very true. This is the golden rule when caring for your client, including preventing neglect. Always ask your client how they want things done. And this includes bathing and hair care, housekeeping, cooking, and see how they feel about the relationship between the client and the caregiver. Some clients like to talk to you while you work. Some prefer to keep things strictly professional. Never neglect the client. Although we ask our clients how and when they want things done, what do you do when they need more care or intervention than they want? For example, a client appears to need their hair washed. They tell you they want to wait a week or two to wash their hair. Is that okay? Well, if the hair is oily in texture, daily shampooing might be necessary, but certainly 2 to 3 times a week may be needed. If the client has hair that's very dry in texture, they may not need shampooing quite so often, but their scalp would definitely need a good hygiene and attention to styling. What about their nails and toenails that are too long, thick, or curled? Don't ignore the nails. Even if they are diabetic and you can't trim their nails, you can't ignore the daily hygiene, filing, cleaning, and the clearing of nails. The nurse supervisors may need to discuss nail care with you more thoroughly regarding care of diabetic client nails if you have a client that is diabetic. It's a matter of the appropriate hygiene for the individual. If you're in doubt, call your supervisor. Never neglect their care. Does this really happen? Sadly, it does. As the baby boomer generation gets older, more clients will need care. Increased caregiver needs will result in many more caregivers being responsible for more clients, and this adds to the stress of the caregiver. And this can be both you or caregiver could mean the client's family. Stress is something that needs to be addressed. Please take time for you. Take a breath. Stress is not an excuse to let any of this happen. Take your role as a caregiver seriously. It's part of your job to protect your client. What about the family? Well, unfortunately, family members have abused their loved ones. Watch out for signs that a family member is at risk. Signs of stress like weight loss, change in demeanor, statements like I can't do this or I'm done. Avoiding their loved one. Waiting just a little bit for you to come instead of assisting their loved one. Help prevent abuse. Abandonment. Client abandonment is defined as leaving the client requiring nursing care without properly notifying the appropriate personnel. An appropriate personnel is a trained caregiver such as a nurse supervisor or a parent. How client abandonment occurs. For client abandonment to occur, the caregiver must first accept the client assignment, thus establishing the caregiver-client relationship, and then disengage the caregiver-client relationship without giving immediate verbal notice to the appropriate personnel, supervisors, directors of nursing, trained caregivers, etc., so that others can make arrangements for continuation of nursing care. Some examples of abandonment. There are, but are not limited to, leaving the client without appropriately and adequately providing arrangements for the coverage, leaving abruptly without giving the appropriate personnel, the nurse supervisor, or a trained caregiver the adequate notice, leaving without reporting to the oncoming shift or trained caregiver, or accepting the assignment of client care, and then leaving the client care setting without notifying the appropriate personnel. When in doubt, call your supervisor. If you're not sure, always report it. Remember, the schedulers are not your nursing supervisors. This completes the PowerPoint. Please proceed to the exam that's following.